So I'm going to start with a topic that perhaps you didn't expect, and something that needs to be spoken about, yet we're a little bit hesitant to speak about it. And something that you're here for. I'm going to speak a little bit about addiction. You see, our modern concept of addiction has changed greatly. We see it now not so much as a medical problem, where we base pathology on the physiology, but we see it now as a societal problem, something that's deeply ingrained in the problems of our society. And in a book, Chasing the Screen, by Johan Hari, he quotes a statistic. 6% of the people before the prohibition of drugs and criminalization of drug abusers were poor. So only 6% of people that abused drugs before prohibition in the US were poor. And this is startling because we now see addiction, the addicts falling into a group of more than 90% that are on the lower socioeconomic bracket. You see, after the criminalization of the individuals, we see them not as sick patients anymore, we see them as criminals. And after controversial events, before the prohibition took place, these addicts became criminals. People who abuse substances were now being abused by the very system that was there to uplift them. And against strong opposition by the medical society, or the medical community at that time, the US went through and prohibited doctors from administration of drugs to patients. And it is a startling idea because, you know, we have this concept in us that drug users and drugs are very, very bad. And yes, drugs are very bad, but drug users most definitely aren't bad people. And against all evidence that criminalization does only worse in the war on drugs, they went through and still criminalized it. And that is the effect of the medical community not having strong enough leaders out there to make a difference. So currently we sit in a situation where the war on drugs has only made it worse. And that is because of the lack of medical input. You see, these are inconvenient things. We feel like we need to push our problems to the side. We don't want to see it on every single day. And this public health care is a strange thing. We so value the fact that we base everything on science and evidence, and this is true. But at the finish line, we have ethics and the humanity of medicine and the allied health sciences guiding us. And interestingly enough, more lawsuits for malpractice comes from doctors and healthcare practitioners that do not treat their patients correctly than healthcare practitioners that mismanage their patients. And that's a significant point. You see, we're in this war. And we often mistake this war on poverty for the war on the poor. You see, and we so often point our fingers to government immediately and say, government's fault. And yes, government has done a horrendous job at this. But the private sector and those people in it have failed miserably as well. These are inconvenient truths. Because your parents are part of the private sector, my parents are part of the private sector, and we will be part of the private sector one day. And at Stellenbosch University, you'll see every second person is a thought leader, and every second person has an opinion about something. And rightfully so, this is why you're here. And you'll hear the word privilege so often. White privilege, gender privilege, historical privilege. And for some reason, we feel that we need to defend this privilege. And the privilege is nothing, it does not need to be defended. And it's true, the privilege is there. You see, all of you are privileged to be here today. Whether you have incredible support from back home, or you were ambitious and had that spark in you, that bit of intelligence in you to push you a little bit further from circumstances that perhaps did not promote tertiary education. You see, that in itself is a privilege. And when I sat here a few years ago, I thought to myself, amongst all these clever people, I'm surely in Hogwarts. This is a letter that must have gotten confused, and I am in a group of incredibly special people. And you know, the truth is, there is a bit of magic in you, and that magic is the fact that we are able to change this country. And you will come across incredible opportunity one day. The opportunity to change lives and communities. And what puts us in a very unique position is that we will go into the smaller communities, being the best educated and well paid, but at the same time being one-to-one with these people. The people that I speak about, the drug users, people in the lower socioeconomic ranks. And what Stellenbosch does, and what Stellenbosch does not do, you will hear throughout the day. You guys will be convinced that you are the cream of the crop. But honestly, I need to say this. This is lack of Marty to us. It is good to be a Marty. And I have no doubt that Stellenbosch has all the facilities and the means to lead you to your success and to develop yourself. And you have a unique opportunity and a window period because you are studying a professional degree to be here for a little bit longer. Use that opportunity. You can ask your folks, there is no better time to develop yourself than there is now. Acquire new skills. Go play outside a little bit more. You know, start piano if you want to. And I'll quickly, the leadership of this university is probably its cornerstone of its teaching. It does not want you to go out there and become a good doctor and just know your science very well. That's beside the point. That no longer is relevant. We have seen that it does not work, and the university now uses leadership as a cornerstone of its teachings. The Tygerberg Student Council, which you will hear as the TSR, is a visible and effective council. It is independent and one of the most effective in the country. And this is a natural thing. You are currently sitting in a room with probably the smartest tricks there were in your year. And as you've heard twice now, Tygerberg is the campus from Campiona, the campus of champions. It exceeds in academics, sports, and a thing called SAD, which you guys will come to learn. We do not lose in SAD. But let the university and the TSR help you broker a good future for you. And I hope you realize that your development is in your hands. The trick is really to just come out your comfort zone. There's an incredible opportunity today that you can start the day anew. You can start your life anew. If you were less confident before, become more confident. If you felt that you didn't study hard enough, start studying hard enough. No one really knows you. And those people that don't know you, it doesn't really matter. You see, you can become whoever you like today, and that is an incredible opportunity. So few people come to tertiary education, and the fact that we are able to study and at the same time develop different facets of ourselves, I can't think of a better opportunity. And one day when you go into this new world, when you've got your degree, when you've been a nice like Marty and you've sung your sad and played your rugby or soccer, you will have a responsibility. And a responsibility not like your peers at Stellenbosch main campus. You will have a responsibility to lead the community and directly affect the social decay in our communities. And remember, when you see your patient with TB, when you see your patient with diabetes, remember that that disease process is not just in that person. It is not an individual disease process, but a symptom of social decay. We are so easily jump to the gun to blame the patient for their life decisions. But we don't realize that there is so much more to a patient. And when you think back to those addicts, which I spoke about at first, and hopefully in a few years' time we don't become cynical towards patients, think back and remember that they are not bad people. They were born just to be humans. And unfortunately, your molding was excellent. That's why you're here today, and theirs wasn't. And this is why it is an incredible opportunity that we get to assist the system. Because we get to see those people on a daily basis. But we have the skills and the knowledge of it. So let's rebuild society. And today, you find yourself in a new home, Tygerberg, for the next 6 or 4 years, or 7 years, or 8, 9, some people try to stay longer. This home will foster a change in you. I cannot say that I was the same person the first year, or even the same person last year. So I hope that you embrace it. Let the Tygerberg Student Council help you embrace it. Let's have a good 2016. Thank you.